Diabetes sends out 15 silent signals at night that can quietly reveal serious health issues. When you close your eyes to rest, beneath the surface, your body is performing a complex dance of metabolic processes, sending hidden messages that often go unnoticed. Sleep isn't just rest. It's a reflection of your overall health. Far too many people dismiss occasional nighttime discomfort or strange sensations as trivial annoyances, unaware that these subtle clues may be the earliest indicators of diabetes. More than 450 million people worldwide live with diabetes, many of whom are unaware of its presence until severe complications arise. The silent nature of this condition means that nighttime disturbances often offer the first glimpses into imbalances brewing beneath the surface. When left unchecked, these minor signals can evolve into major health crises, nerve damage, kidney failure, or cardiovascular events that impact quality of life and increase healthcare burdens. In this video, I will guide you through each of the 15 nighttime signs, explaining what they mean, why they happen, and most importantly, what practical steps you can take to manage or prevent the underlying issue. Throughout this journey, I'll share evidence-based strategies from dietary tweaks and simple lifestyle habits to medical interventions that you can implement immediately. Whether you've just been diagnosed, suspect you might be at risk, or care about someone living with diabetes, this video is designed to empower you with actionable advice. Stick around until the end, and if you haven't already, make sure to hit that subscribe button and ring the notification bell so you don't miss any of our future health insights. So let's get started. Number 1, night sweats, a silent storm. When you settle into bed, your core temperature should gradually decrease as your body enters restful sleep. But if you find yourself waking in soaked pajamas or drenched bed sheets, take notice. In people with diabetes, nocturnal sweating often points to hypoglycemia, blood sugar levels dropping too low during the night. As glucose dips, your body releases adrenaline to mobilize energy stores, inadvertently ramping up heart rate and activating sweat glands, producing an uncomfortable, clammy sweat. Beyond this adrenal response, autonomic neuropathy, damage to the nerves that regulate involuntary functions, can further disrupt sweat gland control, leading to erratic perspiration even when blood sugar remains stable. Recurrent night sweats not only leave you exhausted and irritable the next day, but can also mask other critical warning signs. Left unaddressed, repeated severe hypoglycemic episodes can progress to seizures, loss of consciousness, or even life-threatening coma. To address night sweats, begin by checking your blood glucose before turning in, aiming for a stable range between 90 and 1. If you tend to dip below this threshold, consider a light bedtime snack that balances complex carbohydrates with protein, such as a small apple with a handful of almonds to provide gradual glucose release without spiking your level. Optimize your sleep environment by keeping bedroom temperatures between 64 and 70 F, 18 to 21 degrees C, and using breathable bedding material. A continuous glucose monitor (CGM) can be a game changer by tracking sugar in real time and delivering low glucose alerts. It enables you to intervene before a dangerous drop triggers night sweats. Discuss with your care team the potential to adjust insulin dosage or timing if you're using insulin therapy, as an excessive evening dose could underlie nocturnal hypoglycemia. Remember, not every episode of night sweats is diabetes-related. Factors such as menopause, spicy foods before bed, or anxiety can also contribute. But in someone with diabetes or risk factors, it's best to err on the side of caution. By treating night sweats as a vital piece of your metabolic puzzle rather than an isolated annoyance, you pave the way for deeper, more restorative sleep and greater confidence in your diabetes management routine. Number 2, leg cramps, a sharp pinch. Waking up to a sudden, searing cramp in your calf or foot can feel like a cruel twist of fate, especially when it strikes deep into the night. In people with diabetes, recurrent nocturnal leg cramps often stem from two interrelated issues: an imbalance of key electrolytes, potassium, magnesium, or calcium, and the insidious effects of peripheral neuropathy. Chronic high blood sugar damages the small blood vessels that supply oxygen and nutrients to your nerves and muscles, impairing nerve signals and interrupting normal muscle function. When combined with deficiencies in essential minerals, the result is painful, involuntary muscle contractions that jolt you wide awake. To prevent these jolts, first evaluate your diet. Incorporate potassium-rich foods like bananas, sweet potatoes, or avocados, magnesium sources such as spinach, almonds, and whole grains, and calcium from dairy or fortified plant-based alternatives. Maintaining adequate hydration also supports electrolyte balance. Aim for consistent water intake throughout the day rather than gulping large amounts at night. Before bedtime, perform gentle calf stretches. Stand about 12 inches from a wall, lean forward with your hands pressed against it, and extend one leg behind you to feel a gradual stretch in the back of your lower leg. Hold for 20 to 30 seconds on each side to promote blood flow and muscle suppleness. If cramps persist despite these lifestyle adjustments, it's wise to check your blood sugar patterns. Frequent hyperglycemia and glucose variability can exacerbate neuropathic damage, so targeting a more stable nocturnal glucose profile may bring relief. Finally, consult your healthcare provider to evaluate potential nerve or vascular issues. Early intervention can prevent minor cramps from escalating into chronic pain syndromes. If you're finding this video helpful so far, make sure to subscribe now so you won't miss the rest of our deep dive into diabetes management and nighttime warning signs. Number 3, restless leg syndrome, the endless dance. Imagine lying in bed, your mind drifting towards sleep, only to be met by a tingling, crawling sensation deep within your calves or thighs that creates an overwhelming urge to move. This isn't mere fidgeting. For many with diabetes, it's a manifestation of restless leg syndrome, a condition increasingly recognized as linked to peripheral neuropathy and metabolic disturbances. As persistently elevated blood sugar levels damage nerve fibers, aberrant signals trigger discomfort and restlessness that worsen when muscles are at rest. Compounding this is often an imbalance of dopamine, the neurotransmitter responsible for coordinating muscle movement. Iron deficiency and insulin resistance can impair dopamine synthesis and signaling, intensifying RLS symptoms. The sleep fractures into endless adjustments and pacing, eroding both quantity and quality of rest. To break this cycle, prioritize light, consistent movement throughout the day. Simple routines like an evening walk or gentle leg stretches before bedtime can soothe nerve tension and encourage healthy circulation. Introduce iron-rich foods such as lean red meats or fortified cereals and magnesium sources like pumpkin seeds and leafy greens, as correcting deficiencies has been shown to reduce RLS severity. Additionally, avoid stimulants after mid-afternoon. Caffeine and nicotine can amplify nerve excitability and disrupt the delicate dopamine balance. Establishing a calming pre-sleep ritual, deep breathing, a warm foot bath, or progressive muscle relaxation can shift your nervous system toward a parasympathetic state that quells restlessness. If you continue to struggle despite these measures, consider discussing with your physician the potential benefits of dopamine agonists or other targeted RLS therapies. Identifying and managing RLS early not only restores peaceful nights, but also safeguards your nerves from progressive damage associated with diabetes. Number 4, sleep apnea, a disruption of life's breath. In the hush of night, when breathing should be calm and steady, obstructive sleep apnea shatters that tranquility, intermittently blocking airflow to the lungs and plunging your body into brief states of oxygen deprivation. For people living with diabetes, this condition poses a double threat. Repeated nightly awakenings flood your system with stress hormones like cortisol and adrenaline, worsening insulin resistance and destabilizing blood sugar control, while the cardiovascular strain from fluctuating oxygen levels amplifies the risk of hypertension, heart disease, and stroke. Snoring that alternates with gasping or choking, excessive daytime fatigue, and morning headaches should ring alarm bells for sleep apnea. Yet many overlook the connection to diabetes management. Addressing this dual diagnosis begins with proper screening. Home sleep tests or in-lab polysomnography can measure the frequency and severity of apneic episodes. Should an apnea diagnosis be confirmed, continuous positive airway pressure (CPAP) therapy remains the gold standard, delivering steady breath support to keep airways open and prevent oxygen dips. Lifestyle modifications also contribute significantly. Losing excess weight reduces neck fat that compresses the airway. Maintaining good sleep hygiene diminishes arousal triggers, and avoiding alcohol or sedatives before bedtime prevents the over-relaxation of throat muscles. Some patients benefit from mandibular advancement devices that reposition the lower jaw, while others may require surgical interventions to remove obstructive tissue. By treating sleep apnea, you not only reclaim restorative deep sleep but also improve glycemic control, decrease blood pressure, and boost overall quality of life. If you suspect sleep apnea and live with diabetes, advocate for a comprehensive sleep evaluation. Restoring healthy breathing at night is a cornerstone of optimal metabolic health. Number 5, frequent nighttime urination. Awakening multiple times each night to make pit stops at the bathroom is more than just an inconvenient interruption. It can be a vital clue about how well your body is managing glucose levels. In diabetes, when blood sugar climbs beyond the renal threshold, the kidneys must work overtime to filter and excrete excess glucose through the urine, dragging water along in the process and resulting in polyuria or excessive urination. This can also be compounded by early diabetic nephropathy, where kidney damage impairs their ability to concentrate urine, further exacerbating nocturia. Such sleepless bathroom runs fragment your rest, fuel daytime fatigue, and can precipitate electrolyte imbalances that impact muscle function and cardiovascular stability. To mitigate nighttime urination, start by front-loading your hydration. Drink ample fluids in the morning and afternoon, rather than close to bedtime. Cut back on caffeine and alcohol in the evening, since both act as diuretics, boosting kidney output. Keep close tabs on your pre-sleep blood glucose. Consistently high bedtime readings may call for adjustments to your medication regimen, meal timing, or snack composition to achieve a more controlled glucose profile overnight. High-sodium evening meals draw water into the bloodstream, prompting your kidneys to excrete more fluid. Instead, opt for lighter, low-sodium dinners rich in fiber and lean proteins. If you are on diuretic medications for hypertension, discuss with your doctor the possibility of adjusting dosing times to earlier in the day. Pelvic floor exercises, often associated with incontinence management, can help coordinate bladder contractions and urine flow, improving capacity even in the absence of structural urinary issues. Reviewing nocturnal glucose trends via continuous glucose monitoring can highlight whether hyperglycemic spikes are coinciding with increased urine production. Sharing these insights with your care team can lead to tailored therapeutic adjustments. Remember, persistent nocturia is not merely a nighttime nuisance, but a signal that your metabolic or renal systems may need intervention. Addressing it through hydration scheduling, dietary changes, medication timing, and targeted exercises can dramatically improve both your sleep quality and your overall diabetes management outcomes. Number 6, excessive thirst. The unquenchable urge. Waking in the dead of night with an insatiable craving for water is more than a parched mouth. It's often your body's desperate plea for hydration after relentless fluid loss. With uncontrolled diabetes, elevated blood glucose forces your kidneys to excrete excess sugar through urine, dragging water along and triggering polyuria. In turn, this rapid fluid loss dehydrates tissues, sending signals to your brain's thirst center to replenish. If left unchecked, chronic dehydration strains the kidneys and cardiovascular system, potentially accelerating nephropathy and increasing the risk of electrolyte disturbances, such as hypernatremia, which can manifest as confusion, weakness, or seizures in severe cases. Moreover, nighttime thirst can disrupt sleep continuity, leading to fragmented rest that compounds insulin resistance and destabilizes blood sugar control in a vicious feedback loop. To combat excessive nocturnal thirst, first aim for consistent hydration during waking hours. Sip water steadily rather than large volumes at once, and taper fluid intake 2 to 3 hours before bed. Monitor your daytime fluid intake with a simple water bottle schedule or smartphone app to ensure you meet baseline hydration goals without overloading the bladder before sleep. Evaluate your diet for hidden sources of sugar, including sweetened beverages, sauces, and processed snacks that may be silently fueling hyperglycemia. Incorporating electrolyte-rich drinks, specifically formulations containing balanced sodium and potassium, can help restore lost minerals more effectively than water alone when you experience pronounced dehydration during the day. Additionally, measuring your nighttime urine osmolality under medical guidance can determine if your kidneys are concentrating properly or if there's a defect in antidiuretic hormone, ADH secretion, as seen in some patients with uncontrolled diabetes. In select cases, your physician may prescribe desmopressin, a synthetic ADH analog, to improve nighttime water reabsorption. But this option must be weighed against potential hyponatremia risk. Implementing a cool, humidified sleeping environment can also quell that parched feeling. Dry air exacerbates evaporative water loss through skin and respiratory tracts. Carrying a small glass of water by your bedside rather than a large bottle may help you take moderated sips without overdrinking in one go. By addressing both the behavioral and physiological factors driving your nocturnal thirst, you can reclaim uninterrupted restorative sleep and shield your kidneys from the burden of chronic fluid imbalances. If you're finding these tips helpful, don't forget to subscribe to our channel for more actionable health insights. Number 7. Pain or numbness in the legs. Silent electric shock. Many individuals with diabetes describe nighttime discomfort in their legs or feet as shooting electric shocks, tingling pins and needles, or an unmistakable loss of sensation. This peripheral neuropathy arises when prolonged high blood sugar damages the delicate nerve fibers that transmit sensory information, leading to misfired signals in the absence of actual stimuli. As the nerves falter, common tasks like walking or standing can transform into painful ordeals, but it's at night, when we're still and less distracted, when these aberrant sensations often feel most pronounced. Beyond sleep disruption, numbness in the lower limbs poses critical safety hazards. You may not notice wounds, blisters, or pressure points on your feet, allowing infections to take hold and ulcers to form, which in advanced cases can necessitate amputation. Mitigating these risks starts with rigorous glycemic control, but also includes lifestyle steps such as daily foot inspection, carefully examining the tops, soles, and between your toes for cuts, redness, or swelling. Support circulation and nerve health through light physical activity. Short walks, gentle yoga, or specific foot exercises like ankle rotations can encourage blood flow to compromised regions. Invest in well-fitting, supportive footwear that cushions vulnerable areas and reduces friction. Insoles and diabetic socks, crafted from moisture-wicking fabrics, can further protect the skin. Nutritional considerations are equally vital. Certain studies suggest that supplements such as alpha-lipoic acid, B vitamins, particularly B12, and acetyl L-carnitine, may support nerve repair and alleviate neuropathic pain, although you should always consult your physician before starting any new regimen. For persistent or worsening symptoms, work with your healthcare team to consider nerve conduction studies or electromyography, which can map the extent of nerve damage and guide targeted intervention. Topical treatments containing capsaicin or lidocaine patches may relieve localized pain, while certain oral medications such as duloxetine or pregabalin have FDA approval for diabetic neuropathy and can dampen the muscle's erratic signaling. In advanced cases, a referral to a podiatrist for custom orthotics or debridement of calluses and ulcers may be necessary to prevent complications. Remember, early detection and intervention are your strongest allies against peripheral neuropathy. By addressing pain or numbness proactively, you maintain not only restful nights, but also your independence and quality of life. Number 8. Nighttime hypoglycemia, the silent intruder. While low blood sugar symptoms like shakiness, sweating, and heart palpitations are familiar to many, when hypoglycemia strikes during the night, it can be both stealthy and dangerous. As your body works through the hours of sleep, insulin or diabetes medications can sometimes overshoot, driving glucose levels below the safe threshold, often without waking you until levels become severely low. In response, adrenaline surges to mobilize sugar, leading to symptoms such as restless tossing, nightmares, or abrupt awakenings with a pounding heart. Left unrecognized, severe nocturnal hypoglycemia poses risks of seizures, loss of consciousness, or in the worst cases, death from prolonged glucose deprivation. Prevention hinges on careful monitoring. Check your blood sugar before bed and aim for a target of 91/30 digesting for your individual needs as directed by your healthcare provider. If your reading is below target, a small bedtime snack combining complex carbohydrates with protein, such as oat crackers with cheese, can supply slow-release glucose without significant spikes. Reviewing your medication regimen is equally crucial. Insulin timing or dosage may need recalibration, especially if you're using long-acting formulations that peak overnight. Continuous glucose monitoring, CGM technology, has revolutionized nocturnal hypoglycemia prevention, offering real-time alerts when glucose dips into danger zones and allowing timely correction with fast-acting carbohydrates. If you ever wake with signs of hypoglycemia, follow the 15-15 rule. Consume 15 grams of fast-acting carbohydrates, like glucose tablets or half a cup of fruit juice. Then wait 15 minutes and recheck your levels, repeating as needed until you return to a safe range. Keeping glucose tablets or gel by your bedside can prevent frantic searches in the kitchen that delay treatment. Additionally, notifying a family member or caregiver about your risk and teaching them how to recognize severe hypoglycemia can be life-saving if you lose the ability to self-treat. For patients on oral diabetes medications known to carry hypoglycemia risks such as sulfonylureas, exploring alternative classes like DPP-4 inhibitors or SGLT2 inhibitors may be warranted under medical guidance. Finally, coordinating with your care team about periodic HbA1c checks and patterns of nocturnal glucose variability ensures that your therapy remains aligned with your lifestyle and metabolic goals. By transforming night from a period of vulnerability into one of informed vigilance, you can neutralize the silent intruder of hypoglycemia and rest easy knowing you're protected. Number 9. Insomnia, the battle with the night. Lying awake hour after hour, staring at the ceiling while the minutes tick by, can create a sense of frustration and helplessness. For individuals living with diabetes, insomnia is far more than a simple sleep disorder. It's often entwined with fluctuations in blood sugar levels, stress hormone release, and the metabolic consequences of chronic hyperglycemia. When glucose spikes or crashes during the night, your body perceives these as threats, releasing cortisol and adrenaline to rebalance your system, unwittingly interrupting the deep restorative sleep stages crucial for both physical recovery and insulin sensitivity. Over time, this sleep fragmentation amplifies insulin resistance, creating a vicious cycle. Poor sleep worsens blood sugar control, and unstable glycemic patterns further degrade sleep quality. Tackling insomnia in the context of diabetes management demands a multifaceted approach. First, solidify a regular sleep-wake schedule by going to bed and rising at the same times each day. Even on weekends, consistency reinforces your circadian rhythm and signals your body to prepare for rest. Introduce a wind-down ritual an hour before bedtime. Dim the lights, turn off electronic screens, and engage in calming activities such as reading, gentle stretching, or deep breathing exercises, which can shift your nervous system into a parasympathetic rest and digest state. Evaluate your diet and medication timing. Avoid late-night caffeine or heavy meals, both of which can linger in your system and disrupt sleep onset. Ensuring your evening blood sugar falls within a healthy but stable range, neither too high nor too low, can prevent the physiological alarms that jolt you awake. Optimizing your sleep environment is equally important. Keep your bedroom cool around 65 FWF, 18 Dagshur, dark and quiet. Consider blackout curtains or a white noise machine to mask disruptions, and invest in a supportive mattress and pillows suited to your sleeping position. If insomnia persists, consider professional interventions. Cognitive behavioral therapy for insomnia, CBTI, has demonstrated success in resetting sleep patterns without the side effects of sedative medications, and in some cases, short-term use of melatonin supplements under medical supervision can help reset your internal clock. By viewing insomnia not as an isolated nuisance, but as an integral component of your diabetes care plan, you can reclaim restful nights, reduce stress hormone overload, and boost your metabolic resilience. Number 10. Acid reflux. The smoldering flame. Experiencing a burning sensation in your chest or throat as you lie down may feel like a dietary indiscretion, too many spicy tacos or rich desserts. But in the context of diabetes, nocturnal acid reflux can be a red flag signaling autonomic neuropathy and delayed gastric emptying. When chronic high blood sugar damages the autonomic nerves that regulate digestion, the stomach's natural contractions slow, allowing food and acid to linger longer than they should. This backlog increases pressure on the lower esophageal sphincter, permitting stomach acid to flow back into the esophagus and igniting that familiar flame that can wake you gasping for relief. The impact goes beyond discomfort. Persistent GERD can injure the esophageal lining, interfere with nutrient and medication absorption, and exacerbate glycemic variability as delayed digestion alters blood sugar curves. To douse this inner fire, begin by adjusting your meal timing. Eat smaller portions and finish dinner at least 2 to 3 hours before bedtime to allow gravity to aid digestion. Avoid common trigger foods in the evening, including fatty or fried dishes, chocolate, caffeine, and alcohol, and instead focus on lighter fiber-rich meals that promote gastric motility. Elevating the head of your bed by 6 to 8 inches can harness gravity to prevent acid from traveling upward, and sleeping on your left side positions the stomach below the esophagus, further reducing reflux episodes. Uncontrolled reflux at night can also lead to microaspiration, tiny droplets of acid that enter the lungs, resulting in chronic cough, hoarseness, or even asthma-like symptoms upon awakening. Dental enamel erosion from repeated acid exposure may manifest as increased tooth sensitivity or discoloration, making oral hygiene an important part of your nighttime routine. Rinsing your mouth with water after a reflux episode and waiting at least 30 minutes before brushing can minimize enamel damage. If persistent nocturnal reflux warrants it, discuss with your physician the need for proton pump inhibitors or diagnostic tests such as endoscopy to evaluate for complications like esophagitis or Barrett's esophagus. For those with severe diabetic gastroparesis, a more extreme form of delayed gastric emptying, consultation with a gastroenterologist may reveal prokinetic medications that accelerate stomach contractions, reducing the likelihood of both reflux and erratic blood glucose swings. By taking both mechanical and metabolic steps, you can extinguish the nighttime fires of GERD and sleep in comfort. Number 11. Nightmares or vivid dreams. Horror movies of the mind. Many of us live for the occasional escape into a fantastical dreamscape, but for some individuals with diabetes, nighttime visions become alarmingly intense or disturbing, enough to jolt you awake in a cold sweat. These nightmares or vivid dreams are not mere curiosities of the subconscious. They often reflect underlying physiological stressors, such as extreme blood sugar fluctuations or intermittent hypoxia associated with undiagnosed sleep apnea. When glucose levels plummet or spike rapidly during sleep, the brain's regulatory centers perceive these swings as threats, releasing stress hormones that can warp dream content into scenarios of danger, falling, or pursuit. Similarly, episodes of oxygen deprivation from sleep apnea trigger heightened arousal states, flooding the brain with adrenaline that fuels dramatic dream sequences. Beyond short-term fright, chronic nightmares disrupt sleep architecture, erode sleep quality, and heighten daytime anxiety factors, which in turn can worsen glycemic control, creating a self-perpetuating loop. To calm your mind and mitigate these nocturnal nightmares, prioritize stable blood sugar before bed, check your glucose, adjust medications if needed, and consider a small balanced snack if levels verge on low. Establishing a nightly wind-down routine such as guided meditation, gentle stretching, or listening to calming music can ease the sympathetic fight-or-flight response and prepare your brain for soothing, restorative sleep. If sleep apnea is suspected, characterized by loud snoring, gasping, or excessive daytime sleepiness, seek a formal sleep study for diagnosis and treatment with CPAP or alternative therapies, cognitive behavioral therapy for insomnia, CBTI, and imagery rehearsal therapy, IRT, or psychological interventions proven to reduce the frequency and intensity of nightmares by teaching controlled reimagining of distressing dream content. Lastly, minimize evening exposure to stimulating media or conversations that might prime your brain for adrenaline-fueled dreams. By addressing both metabolic and mental triggers, you transform your sleep from a nightly horror film back into a peaceful retreat that restores both body and mind. Number 12. High nighttime blood pressure. The silent thief. While the healthy body experiences a modest dip in blood pressure during sleep to facilitate restorative processes, individuals with diabetes may instead find that their nighttime blood pressure stays elevated or even climbs a pattern known as non-dipping or reverse dipping. This stealthy phenomenon adds significant strain on the cardiovascular system, elevating risks of heart attack, stroke, and kidney damage over time. The culprit often lies in autonomic neuropathy, where high glucose levels injure the nerves that ordinarily signal blood vessels to relax, preventing the normal nighttime blood pressure decline. Additionally, undiagnosed sleep apnea can trigger surges of cortisol and adrenaline with each oxygen desaturation event, keeping blood vessels constricted. Left unmonitored, high nocturnal pressure silently erodes arterial walls and accelerates diabetic complications. Addressing this silent thief begins with home blood pressure monitoring. Using an automated cuff that logs readings during sleep can reveal dangerous patterns that daytime checks alone miss. Dietary modifications are also key, limiting sodium intake in the evening and focusing on heart-healthy foods rich in potassium, such as bananas and spinach, help regulate vascular tone. Establishing a consistent exercise routine, ideally performed earlier in the day, bolsters overall cardiovascular health and supports normal blood pressure rhythms. If lifestyle measures fall short, your physician may prescribe antihypertensive medications that target nocturnal hypertension, such as ACE inhibitors or angiotensin receptor blockers, and optimize their dosing schedules to cover overnight hours effectively. Treating coexisting sleep apnea with CPAP can further reduce nighttime surges by maintaining steady oxygen levels. Finally, Managing stress through mindfulness practices, yoga, or guided relaxation before bed can calm the sympathetic nervous system, allowing blood vessels to dilate and pressure to drop naturally. By uncovering and confronting elevated nighttime blood pressure, you reclaim the protective dip your body needs to heal, turning sleep back into a time of cardiovascular restoration rather than hidden harm. Number 13, palpitations, the unusual drums in the chest. Feeling your heart pound, flutter, or skip a beat as you lay in the dark can be alarming, even more so for those managing diabetes, where cardiovascular risks are already elevated. Nocturnal palpitations often arise from a combination of factors, including blood sugar swings, electrolyte imbalances, and diabetes-associated heart conditions. Rapid glucose drops trigger adrenaline surges that accelerate heart rate and amplify palpitations, while low levels of minerals like potassium, magnesium, or sodium can disrupt the electrical conductance pathways that maintain a steady rhythm. Moreover, undiagnosed hypertension, sleep apnea, or diabetic cardiomyopathy may underlie persistent irregularities, silently escalating the danger of arrhythmias, heart attacks, or stroke. Soothing these nocturnal drum beats begins with stabilizing your metabolic environment. Monitor blood glucose before bed to ensure you're not drifting toward hypoglycemia, and include nutrient-dense foods with sufficient minerals, such as bananas for potassium, almonds for magnesium, and low-fat dairy for calcium, that support normal cardiac conduction. Avoid stimulants like caffeine, nicotine, and alcohol close to bedtime, as they can amplify palpitations by heightening sympathetic activity. Incorporate stress reduction techniques, such as deep breathing, progressive muscle relaxation, or guided imagery, to calm your autonomic nervous system. If palpitations persist, discuss with your healthcare team the value of an electrocardiogram, EKG, or Holter monitor, which tracks cardiac rhythms over 24 to 48 hours, pinpointing abnormalities that may require intervention. Beta blockers or calcium channel blockers, medications commonly prescribed for irregular heart rhythms, might be recommended to regulate your heartbeat and provide relief. By proactively balancing blood sugar, electrolyte levels, and cardiovascular health, you can transform those unsettling nighttime drums into a steady, reassuring beat that underlies peaceful, restorative sleep. Number 14, teeth grinding. The squeaking sound, waking up with sore jaw muscles, headaches, or chipped enamel can be unsettling. Yet many people with diabetes may not connect these morning complaints to nocturnal teeth grinding, also known as bruxism. Elevated stress hormones triggered by blood sugar imbalances, particularly hypoglycemia, can cause involuntary clenching and grinding of the teeth during the night. Simultaneously, autonomic neuropathy may heighten muscle tension in the jaw, making bruxism more pronounced. The consequences extend beyond tooth wear. Chronic grinding strains the temporomandibular joint, TMJ, leading to jaw pain, migraines, and disrupted facial nerve pathways, which can interfere with eating and speaking comfortably. Mitigating bruxism involves both stress management and direct dental interventions. Begin by establishing a relaxing pre-sleep routine. Practices like progressive muscle relaxation, guided imagery, or a warm compress around the jaw can reduce muscle tension. Maintain stable blood sugar levels overnight to avoid adrenaline-driven grinding. Check bedtime glucose and consider a balanced snack if you're prone to dips, under guidance from your healthcare provider. Talk to your dentist about a custom-fitted night guard, which acts as a protective barrier between upper and lower teeth, absorbing grinding forces and preserving enamel. In some cases, low-dose botulinum toxin injections into the masseter muscles can reduce hyperactivity and provide relief for persistent severe bruxism. Additionally, practices such as mindfulness meditation or gentle yoga can address underlying stress and anxiety that may be exacerbating teeth grinding. By combining metabolic, behavioral, and dental strategies, you can silence the squeaking sounds of bruxism, protect your oral health, and ensure that your nights and mornings are pain-free. Number 15, morning headaches. The painful morning greeting, rising with a persistent headache, can cast a shadow over the entire day, especially when that pounding ache is more than just a one-off migraine, but rather a recurring sign of nocturnal metabolic or respiratory distress. In people with diabetes, morning headaches often trace back to periodic hypoglycemia, when blood sugar falls too low during the night, depriving the brain of essential fuel and triggering a reactive surge of stress hormones that manifest as throbbing pain upon waking. Sleep apnea also contributes, as oxygen desaturation and fragmented sleep stimulate inflammatory mediators and elevate blood pressure, leading to headaches alongside daytime fatigue. Dehydration from frequent nighttime urination can further compound these effects by shrinking blood vessels in the brain and inducing tension. Counteracting morning headaches requires a three-pronged approach. First, evaluate your blood sugar management, check fasting glucose levels, adjust evening snack choices, and discuss with your doctor whether your insulin or medication regimen needs alteration to prevent nocturnal lows. Second, if sleep apnea is suspected marked by loud snoring, gasping, or unrefreshing sleep, undergo a formal sleep evaluation. Treatment with CPAP or oral appliances can restore oxygen flow and reduce headache frequency. Third, address hydration and electrolyte balance. Ensure you're drinking enough fluids throughout the day, and include foods rich in potassium and magnesium, like bananas or leafy greens, to support vascular health. For immediate relief, over-the-counter options such as acetaminophen or migraine-specific medications can help, but chronic reliance on painkillers risk rebound headaches and kidney strain, particularly in diabetes. Instead, focus on preventive measures. Maintain consistent sleep patterns, optimize your sleep environment to minimize disturbances, and use relaxation techniques such as guided meditation or gentle stretching to ease tension before bed. By intercepting the triggers of morning headaches, be it low glucose, hypoxia from apnea, or dehydration, you transform waking pain into clear-headed energy that sets you up for a productive day. From night sweats to morning headaches, these 15 nighttime signs may appear insignificant, but are powerful indicators of your body's metabolic health. Empowerment. By recognizing and addressing each warning, whether through adjusting your nighttime snacks, optimizing your sleep environment, or consulting your healthcare provider, you reclaim control over diabetes management and transform restless nights into restorative sleep. Small actions like checking your blood sugar before bed or elevating your head position can prevent serious complications and enhance your quality of life. Share this video to spread awareness, and don't forget to subscribe for more health tips.